Today I'm bringing a detailed analysis of Chapter 4 of the Art Therapy Handbook, which is Therapy in Art Therapy. This chapter focuses on the core process of art therapy, explores how art creation can be a bridge for emotional expression, and emphasizes the role of therapeutic relationships, spectral setting, transference and counter-transference, and interpretation in art therapy. I will summarize the following points. First of all, let's talk about the core of art therapy, the creativity and expression. The therapeutic value of artistic creation. The core of art therapy is the creation, but not the work of art itself. The creative process simulates internal emotions and expressing them consciously or unconsciously through materials such as painting and sculpture. Artwork may seem chaotic and raw, but they provide patients with a non-verbal opportunity to explore and sort through emotions. Also, work of art can be used as psychological mapping. Patients' creations often reflect their subconscious mind, and therapists can understand patients' mental states by observing symbols, colors, and layouts in their words. We also have the prehistorical art and human expression. Human artistic expression has existed since ancient times. Prehistorical petroglyphs, graffiti, and hieroglyphs, and etc. were originally intended for communication, documentation, and later evolved into self-expression. Primitive art and the modern art therapy is the same thing. The Stephen Metheny process proposed that early human painting was not just a record, but a way to express emotions. This primitive form of expression has a similar effect to the free painting or graffiti therapy in art therapy. The role of visual art in therapy has the multi-layered meaning of the word. The meaning of the word of art is opened. Stephen points out that painting, unlike language, has a multi-layered meaning, and the viewer's understanding changes over time. Works of art can be interpreted on social, political, cultural, and psychological level. Many emotions are difficult to express through words, but they can be presented through images, which means the unspeakability of images. Even a simple choice of line or colors can contain deep emotions. For example, black may represent depression or anger, and red may represent passion or aggression. The visual art as a symbolic language means the image is not only a visual representation, but also a psychological symbol. Color, shape, brush stroke, position, and etc. can reveal underlying emotions and psychological conflicts. For example, repetitive brush strokes may symbolize obsessive thoughts. A chaotic pattern that lacks shape may reflect anxiety or a sense of loss of control. The setting of art therapy included the therapeutic space, the dual role of physical and psychological space. Coase argues that the therapeutic space is not only a physical environment, but also contains psychological boundaries. Winnicott proposed that transitional space, a mental area between reality and fantasy, to help patients explore themselves. Art therapy space should provide a sense of security and encourage patients to express themselves freely without criticism or judgment, which means the establishment of a sense of security is important, and also the boundaries. Boundary setting helps build trust. By setting the time, interaction rules, and etc., it helps patients from a safe psychological framework. For example, the start and the end time of each session are specific to ensure predictability. The therapist does not arbitrarily evaluate the work but allows the patient to interpret it for himself. The intimacy of the artwork. The work may become the patient's private sphere. Schafferin states that patients may be reluctant to show the words to therapists, reflecting their psychological defense mechanism. Now, let's move to the transference and counter-transference. The transference means the patients project early life emotions onto the therapist. Freud proposed that patients bring unresolved emotional patterns from childhood into therapeutic relationships. And Callan further states that children inhibit latent, unconscious fantasies in play and artistic creation. The counter-transference means the therapist's emotions response is also part of the therapist. Heyman argues that the therapist's feeling can serve as a clue to the patient's psychological state, and Baum emphasized that therapists should be psychological containers that help patients solve for difficult emotions. The interpretation means the gradual emergence of works of art. The meaning of the words is not immediately clear, but emerge over time. Therapists should avoid premature explanations which may interfere with the patient's self-discovery process. Now, let me give you some case studies. Now, it's about Peter's cases. Peter is a 10-year-old child who has developed separation anxiety and behavioral problems due to the death of his older brother. He used clay in his healing to make two heads that symbolize himself and his brother. Peter's repeats adjustments, destruction, and restoration of the work may have symbolized his fear of loss and his attempt to repair his emotions. The black coating of the work may represent his emotions towards death and grief. The therapist did not explain directly, but waited for Peter to explore the meaning of the word himself. Peter eventually realized his anxiety and expressed it through his work, completing his psychological growth. The language with nonverbal communication is a very important thing in art therapy. Winnicott proposed that Language is an extension of mother-to-child communication, but nonverbal artistic expression is equally important. Premature verbal interpretation can disrupt the patient's autonomous exploration and make them feel intrusive. The importance of metaphorical expressions. The therapist should respect the patient's creative rhythm and not rush to interpret the word as some kind of symptom or psychological problem. Okay, that's all for today. Let me give you some summary and the key takeaways. Artistic creation is a bridge to express emotions and help patients release and organize their inner emotions. The meaning of the image is multi-layered, and the therapist should avoid premature interpretation and let the patients explore it on their own. A safe therapeutic space and clear boundaries help build a sense of psychological safety. The transference and counter-transference play an important role in the therapeutic process, influencing the interaction of the therapeutic relationship. And finally, the case studies from Peter shows that art can help patients understand their emotions and repair them psychologically through creation. That's all for today. Thank you for watching, and we look forward to seeing you in the next video.